They told you cannabis would destroy your brain, that daily use would turn you into a foggy, unmotivated shell of yourself. That at 60+ years old, the last thing you should be doing is using marijuana regularly. But here's what's actually happening. Thousands of older adults are using cannabis daily, and their doctors are shocked by their blood work. Inflammation markers dropping, sleep quality improving, chronic pain becoming manageable without opioids, cognitive function stabilizing or even improving instead of declining. This isn't what the drug war propaganda predicted. This isn't what medical school taught doctors to expect. And it's certainly not what mainstream medicine wants you to know about aging and cannabis. So what actually happens to your body when you use cannabis daily after 60? The real answer, backed by emerging research and clinical observations, is far more complex and surprising than either the fearmongers or the enthusiasts want to admit. Let's break down exactly what occurs in your aging body when cannabis becomes a daily habit, system by system, effect by effect, with brutal honesty about both the benefits and the risks. Your brain after 60 is not your brain at 40. Neural connections that used to fire rapidly now sputter. Neurotransmitter production drops. Inflammation increases. Blood flow decreases. This is considered normal aging, inevitable, irreversible, something to accept with resignation. Then daily cannabis use enters the picture, and something unexpected happens. The endocannabinoid system, that network of receptors throughout your brain that regulates memory, mood, pain perception, and countless other functions, has been declining along with everything else. Your body produces fewer endocannabinoids naturally as you age. The receptors become less sensitive. This deficiency contributes directly to age-related cognitive problems. Daily cannabis supplementation restores activity to this system, not occasionally, not sporadically, consistently, every single day, providing cannabinoids that your body no longer produces adequately on its own. Within the first month of daily use, most people notice sleep changes first. Deep, restorative sleep returns after years of fragmented nights. This matters enormously because your brain clears metabolic waste during deep sleep, waste that accumulates and contributes to cognitive decline when sleep is poor. By month 3, the neuroinflammation that's been silently damaging brain tissue starts decreasing. Cannabinoids, especially CBD, are potent anti-inflammatory agents. Chronic brain inflammation drives much of age-related cognitive decline. Reducing it consistently, day after day, allows neurons to function better and survive longer. Around month 6, something remarkable often occurs. Cognitive testing shows improvement rather than the expected continued decline. Word finding gets easier. Mental fog lifts. Processing speed increases. Memory consolidation improves. This isn't universal. Some people respond better than others. But the pattern is consistent enough that researchers are genuinely excited. One study found that older adults using cannabis daily scored better on cognitive tests than non-users in the same age group. Brain imaging showed increased connectivity and activity. The mechanism appears to involve neuroplasticity, the brain's ability to form new connections and adapt. Daily cannabis use seems to enhance this capacity, essentially helping aging brains maintain the flexibility they're naturally losing. But there's nuance here that's critical to understand. High THC products used heavily can impair cognitive function even in older adults. The therapeutic window exists in low to moderate doses, typically 2.5 to 10 milligrams of THC combined with CBD, used consistently but not excessively. Overdoing it doesn't produce better results, it produces impairment. The goal is supplementation, not intoxication. Chronic inflammation isn't just damaging your brain, it's attacking every system in your body. After 60, inflammatory markers like C-reactive protein and IL-6 typically run higher than they did in youth. This chronic, low-grade inflammation contributes to arthritis, cardiovascular disease, diabetes, autoimmune conditions, and cancer risk. Daily cannabis use dramatically reduces systemic inflammation. Both THC and CBD have potent anti-inflammatory properties, but they work through different mechanisms. Used together daily, they provide consistent suppression of inflammatory processes throughout the body. People notice this first in joint pain. Knees that ached every morning hurt less. Hands that were stiff and painful regain mobility. This isn't just pain being masked. Actual inflammation is decreasing, which shows up in blood work. C-reactive protein levels often drop significantly within 3 months of daily cannabis use. Patients show their doctors these results, and physicians are frequently surprised. They weren't expecting improvement. They were expecting continued deterioration. The cardiovascular benefits extend beyond inflammation reduction. Daily cannabis use appears to improve endothelial function, the ability of blood vessel walls to dilate and constrict properly. This directly affects blood pressure, circulation, and heart disease risk. Population studies consistently show that regular cannabis users have lower rates of hypertension, metabolic syndrome, and obesity compared to non-users in the same age groups. The mechanisms are still being elucidated, but the pattern is clear. However, and this is important, the cardiovascular effects are dose-dependent and method-dependent. Smoking cannabis, especially heavily, can cause respiratory issues that offset cardiovascular benefits. Vaporizing or using edibles avoids this problem. And high doses of THC can cause temporary increases in heart rate, which could be problematic for people with existing cardiovascular disease. This is why starting low, working with healthcare providers, and monitoring responses is essential. After 60, pain often becomes a constant companion. Arthritis, old injuries that never quite healed, degenerative disc disease, neuropathy, the list of age-related pain conditions is extensive. The conventional medical response is NSAIDs that destroy your stomach and liver, or opioids that create dependence and cognitive impairment. Daily cannabis use provides an alternative that many find superior for chronic pain management. The pain doesn't disappear. This isn't a miracle cure, but it becomes manageable in a way that allows actual life, rather than just existence. The pain relief from cannabis is multifaceted. THC directly reduces pain perception through CB1 receptors in the nervous system. CBD reduces inflammation that causes much chronic pain. Terpenes like myrcene and beta-caryophyllene provide additional analgesic effects. Used daily, these compounds maintain consistent pain control without the tolerance issues that plague opioid use. People using cannabis daily for pain often find they can reduce or eliminate other pain medications. Their doctors see them functioning better, more active, better mood, improved sleep, without the zombie-like qualities that opioids produce. The key is consistency. Sporadic use doesn't maintain stable pain control. Daily use keeps cannabinoid levels steady, preventing the pain spikes that occur when medication wears off. But daily use for pain requires finding the right dose. Too little provides inadequate relief. Too much causes unwanted intoxication. The therapeutic window is individual and requires experimentation to find. Most people settle on a pattern. Low dose throughout the day for baseline control, often CBD dominant, with slightly higher THC doses in evening when pain tends to worsen and when intoxication is less problematic. Sleep architecture changes dramatically after 60. Deep sleep becomes rare. Light sleep dominates. Wake-ups multiply. You spend 8 hours in bed but get maybe 5 hours of actual rest, and only a fraction of that is the deep, restorative sleep your body desperately needs. Daily cannabis use, specifically evening doses, restores deep sleep for many older adults. This might be the single most impactful benefit because sleep affects everything else. Cognitive function, immune system, cardiovascular health, pain perception, mood, all depend on quality sleep. The effect is often dramatic and immediate. Within days of starting evening cannabis use, people report sleeping through the night for the first time in years. They wake feeling actually rested rather than exhausted. Sleep tracking devices confirm it. deep sleep percentages increase significantly. The mechanism involves several factors. THC reduces sleep onset time. You fall asleep faster. It increases deep sleep duration. It reduces REM sleep somewhat, which might sound negative but can actually reduce nightmares and reduce the wake-ups that often occur during REM. CBD reduces anxiety that interferes with sleep and may help maintain sleep throughout the night. However, there's a tolerance issue that develops with daily use. The sleep-promoting effects can diminish over time, requiring dose increases or periodic tolerance breaks. This is manageable, but needs to be understood. Some people also experience grogginess the next morning, especially with higher doses or certain strains. This is usually avoidable through dose adjustment and timing. Taking cannabis 2 to 3 hours before bed rather than right before allows some metabolism before sleep. The sleep benefits alone convince many older adults that daily cannabis use is worthwhile. Everything else functions better when sleep is restored. The immune system becomes dysregulated with age. It becomes both weaker, more susceptible to infections, less able to kill cancer cells, and overactive in wrong ways. Autoimmune issues, excessive inflammation. Daily cannabis use appears to help rebalance immune function through the endocannabinoid system's role in immune regulation. The effect is immunomodulatory. It doesn't simply suppress or enhance immunity, but helps restore appropriate responses. Studies show that regular cannabis users have different inflammatory profiles than non-users. Certain inflammatory markers decrease, while protective factors may increase. The clinical implications are still being studied, but early evidence suggests reduced autoimmune symptoms and possibly even reduced cancer risk, though the latter remains controversial and unproven. What's clearer is that daily cannabis use doesn't appear to suppress immune function in ways that increase infection risk. Some worried it might, but population data doesn't support this concern for moderate use. Metabolic syndrome, that cluster of conditions including high blood pressure, elevated blood sugar, excess abdominal fat, and abnormal cholesterol, becomes increasingly common after 60. It's a major risk factor for heart disease, stroke, and diabetes. Surprisingly, daily cannabis users show lower rates of metabolic syndrome and obesity, despite stereotypes about the munchies leading to weight gain. Multiple large studies confirm this pattern. The mechanisms appear to involve improved insulin sensitivity, effects on metabolism, and possibly behavioral factors. Cannabis users seem to have better glucose control and lower fasting insulin levels. This doesn't mean cannabis causes weight loss. It doesn't reliably, but it doesn't cause the metabolic deterioration that many expected. Some people do experience increased appetite, especially initially, but this often normalizes with continued use. Daily cannabis use isn't all positive adaptations. Your body changes in response to consistent cannabinoid exposure, and not all changes are beneficial. Tolerance develops to many effects. The sleep improvement that was dramatic at first becomes less pronounced. The pain relief requires higher doses over time. The mood enhancement diminishes. This is normal pharmacology. Your body adapts to any substance used daily. Managing tolerance requires strategies. Taking periodic tolerance breaks, a few days to a week without cannabis every few months, rotating strains with different cannabinoid and terpene profiles, using the minimum effective dose rather than escalating unnecessarily, and combining cannabis with other pain management or sleep strategies so it's not the only tool. Some people experience dependence, not addiction in the clinical sense, but physical adaptation where stopping causes withdrawal symptoms. These are typically mild compared to opioid or benzodiazepine withdrawal, irritability, sleep disturbance, reduced appetite, mild anxiety. They resolve within days to a week. This isn't a reason to avoid daily use. The benefits often far outweigh this manageable issue, but it should be understood going in. Cognitive effects are complex. While many people experience cognitive improvement, others notice short-term memory issues, especially with higher doses. The key is finding doses that provide benefits without impairment. Respiratory issues can develop with daily smoking. This is avoidable by choosing non-smoking methods, vaporizing, edibles, tinctures, topicals. But many older adults who smoke daily do develop chronic bronchitis symptoms. Drug interactions are real and potentially serious. Cannabis affects liver enzymes that metabolize many medications. Daily cannabis use can alter blood levels of blood thinners, some blood pressure medications, and various other drugs. This requires medical supervision and sometimes medication adjustments. Cardiovascular concerns exist for people with serious heart disease. While cannabis may help prevent cardiovascular problems, acute effects in people with existing severe disease are less certain. Anyone with significant heart disease should use cannabis only under cardiologist guidance. The method of consumption dramatically affects daily cannabis use outcomes. This isn't minor. It fundamentally changes the experience and health impacts. Smoking is the fastest acting but hardest on lungs. Daily smoking will likely cause respiratory irritation and chronic bronchitis symptoms over time. It's also the most difficult method for dose control, not recommended for daily long-term use in older adults. Vaporizing flower provides fast effects like smoking, but with significantly less lung irritation. It's a reasonable option for people who want immediate effects and can control dosing. Quality dry herb vaporizers are essential. Cheap vape pens with mysterious cartridges should be avoided. Edibles provide long-lasting effects, but are notoriously difficult to dose properly. Effects take 60 to 90 minutes to appear and can last 6 to 8 hours. This makes them excellent for all-day baseline relief or for sleep, but problematic for acute symptom management. Starting doses should be very low, 2.5 millimolars, THC or less, because overconsumption is miserable and common with edibles. Tinctures and oils offer the best combination of dose control, health safety, and flexibility. Sublingual absorption provides effects in 15 to 30 minutes. Doses are precise and adjustable. No lung exposure. This is often the optimal choice for daily use in older adults. Topicals work for localized pain without any psychoactive effects, useful as adjunct therapy, but insufficient alone for most people. For daily use, most people develop a multi-method strategy. Low-dose tincture in morning for baseline support, another dose mid-afternoon if needed, higher dose edible, or tincture in evening for pain and sleep. This provides consistent cannabinoid levels throughout the day, while concentrating stronger effects when they're most needed and least disruptive. If you're considering daily cannabis use after 60, here's the realistic protocol that works for most people. Start with CBD only for 2 weeks. Use 15 to 25 mg twice daily. This allows you to experience cannabinoid effects without intoxication and establishes whether you're sensitive to cannabis in any way. If CBD alone is insufficient, and for many it is, add very low dose THC. Start with 2.5 milliliter combined with CBD, taken in the evening. Monitor effects for at least 3 days at this dose before considering any increase. Increase very slowly if needed. Go up by 2.5 milliliter increments, waiting several days between increases. The goal is the minimum effective dose, not maximum tolerable dose. Track systematically. Keep a daily log. What you took, when, dose, effects, side effects, sleep quality, pain levels, anything else relevant. This data is invaluable for optimization. Get regular blood work. Monitor inflammatory markers, metabolic panels, liver function. This provides objective evidence of whether cannabis is helping or causing unseen problems. Communicate with doctors, even if they're skeptical. They need to know you're using cannabis to watch for interactions and interpret symptoms correctly. More doctors are becoming educated as cannabis becomes mainstream. Plan for tolerance breaks. Every 2 to 3 months, take 3 to 5 days off cannabis to reset tolerance. Yes, it's uncomfortable. Yes, it's worth it. Use high-quality products from reputable sources with third-party testing. The unregulated cannabis market is full of contaminated products, mislabeled products, and outright dangerous products. Verify what you're consuming. Thousands of people over 60 are now using cannabis daily with remarkable results. They're sleeping better, thinking clearer, moving with less pain, feeling more engaged with life. Their inflammatory markers are improving. Their pain medication use is decreasing. Their quality of life is genuinely better. But they're also dealing with tolerance, managing dosing, navigating a confusing legal and medical landscape, experimenting to find what works for their individual bodies, taking periodic breaks, explaining to skeptical doctors and family members. Daily cannabis use after 60 isn't a simple miracle solution. It's a powerful tool that requires intelligence, caution, and commitment to use effectively. The people seeing the best results are treating it seriously, tracking carefully, dosing conservatively, combining it with other health practices, working with healthcare providers when possible. What happens to your body when you use cannabis daily after 60? Your endocannabinoid system gets the support it's been lacking. Inflammation decreases, sleep improves, pain becomes manageable, cognitive function stabilizes or improves, metabolic markers often get better. But tolerance develops, dependence can occur, side effects happen. Not everyone responds the same way, and it requires ongoing management, not just passive consumption. Is it worth it? For many older adults dealing with the accumulating health problems that come with aging, the answer is clearly yes. The benefits substantially outweigh the drawbacks when done properly. But done properly is the key phrase. Random cannabis use won't produce these results. Strategic, informed, consistent use might, and that distinction makes all the difference.